Hello, everybody. Good afternoon. Let's talk about some more oral pathology questions because I would say that oral pathology seems to be the topic where all of you guys are going through the most and even taking the quiz again a couple times. So I thought it just made sense to add some more questions since you all seem to want to learn all about oral pathology. So these ones are a little bit trickier. These ones are definitely for those who have started to study oral pathology. If you have not started studying oral pathology yet, I would suggest going with another topic because these aren't something that you would just know. You do have to study them first. So let's go through this question here. So which of the following has a cauliflower-like appearance? Now I did leave an image there for you, which I can't seem to make larger. I apologize, but you don't really need the image to answer the question. So just as a reminder, if you guys want the right answer right away, you just have to look where the check mark is here. Okay, so this is the wrong answer, this is the wrong answer, this is the wrong answer, but the check mark one, that is the correct answer. So this is the papilloma. The other ones do not have a cauliflower-like appearance. And on the board exam, you know, they like to tell you what things look like and they like to use different words for different things. But the papilloma is the only one that can have that like white cauliflower-like appearance. So that is the only one. The others just simply do not. They could look like almost anything. As an example, the traumatic fibroma could be like a red lumpy lesion, but that would not look like a white cauliflower lesion at all. Lymphoma could be like a yellowish, even brownish lesion sometimes, but not like a white one. You know, things along those lines. So papilloma, always, always, always think white cauliflower-like. Okay, next one. Once surgically excised, can lipomas reoccur? So meaning once a lipoma is taken away, can you bring that back? So we're talking about something different now. For a lot of things out there, even if it's been surgically removed, it can grow back. So you have to know which ones can and which ones can't. For the real world, honestly, you don't have to, but for the board exam, yes. So for a lymphoma, this cannot come back. I mean, it can, yes, but it's rarely happened, so that would be the best answer. Technically, yes, it can happen after a couple of years, but when you're talking to a patient, if they ask you this question, you would not say, well, it's rare, but could happen after a few years. You know, you want to give them the one answer, which is why is rare is the most correct answer of all of these. Now, some of you guys did say a yellowish lesion, which is actually true, but that's not the question. A lymphoma is a yellowish type of lesion, as I said before, sometimes brown, but that's not in the question. So always read the question to kind of know what it's asking. Okay, next one. Which is common to be found on the vermilion border of the lips? The hemangioma is the only one. The rest of these are commonly found either on the like cheeks, nose area, inside the mouth. Lymphoma is commonly found like those like eyelid areas, like eyelid, like under the eye, the face. Pyogenic granuloma, think of a pregnancy tumor. So that would be typically found on the attached gingiva. Warts could be anywhere actually, but just not commonly, I would say, on the border of the lips. Like it can be found on the palate, on the tongue, inside the mouth, but not usually, even outside the mouth actually too, but not the border of the lips. So the hemangioma is the best answer there. Denture-induced fibrous hyperplasia happens with these patients. So in which one of the following patients does this happen in? Denture-induced fibrous hyperplasia. So a lot of you said in seniors, and that's not correct. The correct answer is if they wear a denture, because just because you are a senior doesn't mean you are automatically needing a denture, right? It does not mean you need a denture. So that's why seniors is not correct. Seniors is the right answer if they wear a denture, but that's not in the answer, right? So the best answer is the second one. A lot of you guys said old dentures as well, which could be true, but keep in mind, just because a denture is old, does that mean that this will happen? No. Even if somebody wears a denture, does that mean this will happen? No, but that is still the best answer, because the question is, what happens in these patients? So in the patients who have old dentures, will this happen? Well, maybe not. That's not the best answer. But it will usually happen in somebody who wears a denture. So that's why B is the most correct. A lot of you guys did get this one wrong. But I think it's just because the answers are all very, very close. I took this one from the Mosbys, and the answers are exactly the same. So this is what they actually did have in the textbook. So that is why B is the most correct. And they just said, because looking at it overall, that's why that is the most correct to this one here. Okay, what is a peripheral giant cell granuloma caused by? Local irritants is the best answer. It's not caused by any of these things. It's just basically caused by if something's been irritating that gingival area, then a peripheral giant cell granuloma can happen. Has nothing to do with a denture. Technically, if a denture is in that area rubbing the wrong way, then it could cause a giant cell granuloma, but still the best answer would be local irritants, because if there's a local irritant, that can happen. Pregnancy has nothing to do with it, and hormones has nothing to do with it either. What is a pulp polyp? Pulp polyp, what is that? It is found in teeth with large open carious lesions. Has nothing to do with any of these. Technically, if the child has poor oral hygiene, they will likely get a large cavity and then have it not looked after, perhaps, if the parents aren't taking the dentist, or are not taking the child to see the dentist often. So C is not wrong, but still not the best answer, because just because a patient has poor oral hygiene doesn't mean a pulp polyp will happen, right? But with a large open carious lesion, well, this could happen literally any time because it is open to the oral cavity. Bad things can happen. So I don't know if any of you guys have seen this. If you've been a dental assistant before, you probably have. It happens a lot. It's quite sad, actually. But that's why A is the best answer. So does everybody understand that? Some of you guys did say the last one, but I think you possibly read that wrong, because it could be found in primary molars, but not permanent. That's not the common spot for it. And that's just not, I mean, technically, yes, I guess it could be there, but not usually. That's just not what it is, you know? So does that make sense? But if you guys need more help with that, just let me know. What causes internal resorption? They love to ask about internal resorption, let me tell you. So that is caused by trauma. So this is the typical case where a patient tells you they had an accident and they got their front teeth hit, or they tripped on the sidewalk or something and they hit their mouth. Often if somebody has a toddler and they're playing with the toddler and the toddler somehow hits them in the chin or in the mouth area. So caused by trauma. This is that patient that will come in and say, yeah, I got hit in the mouth really, really hard. It was quite sore, but it seems okay now. Always take that anterior PA, because you need to check for this. If you guys remember, though, this will not show up right away, so it might not happen. It might not show up. Let's say you take the x-ray that day. It might not show up. Take an x-ray a couple months to 6 months later to just look at the comparison. So it's always a good idea to take an x-ray, obviously, that day if they come in for an emergency exam, but then tell them at your next cleaning and checkup, we will be taking another x-ray to check it. In the meantime, look for if the tooth becomes loose. You know, that's pretty obvious. That's that something's wrong, but still let them know that. or if the tooth changes color. So just a little side note for everybody there. I kind of might have answered this for you. So your patient's upper front tooth appears almost pink. What could this be? Internal resorption. So sorry, I kind of answered that for you guys. This is internal resorption. It's quite common. I did explain that more in the past one. So, sorry, in the previous question. But yeah, that's the best answer. If a tooth is pink, it's probably not stains, probably not caries, it's probably not a polyp, because all of those are more obvious. You don't look for something pink in those cases, but internal resorption, yes, you do. A periapical granuloma can happen in, so you have to know what the periapical is, right? This can happen in a non-vital tooth. Best and only answer. It will not happen with the tooth that's still alive. It will not happen in an open carious lesion, and it won't happen under a crown. Technically, it could if these areas were a part of a non-vital tooth. So yeah, technically it could, but still the best answer you want to know here is the non-vital tooth. Because if you were to answer, let's say, under a crown, well, yes, that could happen, but don't you want to know more that it happens in a non-vital tooth? Because anything can happen under a crown, but we're talking specifically about a periapical granuloma. So always look at the keywords, okay? So does that make sense? So always look at the keywords. Another of the same type of question. How will a periapical granuloma appear in a radiograph? So what does this look like? So even if you were looking at the past question and thinking, what's a periapical granuloma again? This is when you should stop and look through your notes, because this is something you have to know, and then you can try to answer the question that way, right? So what does this look like in the X-ray? So a lot of these sound very similar, don't they? So this would be a tricky one to memorize because you might have memorized the first part of it, but not the second part. So the best answer is a well-defined radiolucency. So it shows up as a dark area in the X-ray. So not a white area, but shows up as a dark area, okay? So something to make note of. When looking at a radiograph, you see radiolucencies occurring in groups. This is giving a honeycomb appearance. What could this be? So again, the board exam will ask you about different types of appearances, and all of these come from the textbook. So this isn't just something that I'm making up. These are right from your textbook. So there's one thing you need to memorize that has a honeycomb appearance. Does anybody know what that is? So it is the odontogenic myxoma, if I'm saying that properly. That's the only one with a honeycomb appearance. That's the best answer. It's radiolucent, not radiopaque. You have to know which ones are which. An osteoma may appear in a radiograph as what? So what is an osteoma? Not good news. So an osteoma is a radiopaque mass. So not radiolucent, radiopaque mass. Did I spell that right? I think I did. Radiopaque mass. None of these other ones are correct. Now, a lot of you guys did say number C, or I'm sorry, letter C. It is a mass, but you likely wouldn't see it in a bite wing. You would likely see it in a panorex or perhaps a PA, but probably a panorex, because these things aren't usually near the roots of the teeth or, you know, near the crowns even. They're kind of off to the side. So the only way to see those areas, right, would be the panorex. A PA would not be wrong, but a panorex is the better answer. Okay, so just something to make note of. This is why we should be taking a panorex in the dental office at least every 10 years. Probably every 5 years is better, because you might see things that you're not expecting that won't come up in typical x-rays. So just something to tell your patients too, who might be hesitant, like, oh, a pano, what? Why do I have to take that? I've never had that done. Well, you should have had it done. Let's take it today just to make sure and put your mind at ease. So that's just something that I do mention to them. When you see a pink enlargement of papilla, it is quite smooth. What could this be? So you might have all these ideas going through your head. I would say the key word here is smooth. pink enlargement is obviously a keyword too, but just so you guys have an idea here. So this would be called an irritative fibromatosis. It could be called a lot of things, but just out of all of these different answers, this is the best one because the other ones just don't make sense. Acute gingivitis, I would not say it would be pink, right? That would be more like red, a dark red, even purple in extreme cases. So just saying acute gingivitis isn't really true because we're saying pink, and pink we always say is healthy, right? Not all the time, but if you still had to pick one, this would be the best one. These ones just aren't simply the best answer. So a lot of you guys did say D, but that's just why that's not correct, because acute gingivitis, you do not think pink. You do not think pink enlargement of the papilla. You might be thinking red, swollen gums, painful to the patient, something stuck in their sulcus, things like that. How do you treat irritative fibromatosis? So what we just talked about, how do you treat that? This would be improved oral hygiene. So once they start doing everything they're supposed to do, that sort of lump will go away. That's the best answer. Obviously, you don't need a root canal, you don't need extraction, you do not need a filling and a crown, because we're not talking about the tooth here, right? We're talking about the gum area. You do not get lesions on the tooth, you know, other than a cavity, I suppose, right? But you would not get like a pink lump on the tooth. So that's why improved oral hygiene makes the most sense. Your patient comes in for her regular cleaning and she points to her upper left side of her mouth. She says she's hurt herself the other day when brushing her teeth. The toothbrush slipped. What could you be looking at? A lot of you guys said, probably thinking toothbrush abrasion. So I tried to trick you guys there, and a lot of you got the wrong answer. So the right answer is a traumatic ulcer. So B is not correct because you would not be looking at toothbrush abrasion if it had just happened. Toothbrush abrasion takes time, right? It doesn't just happen overnight. So you would be looking at more something that would happen overnight, and that would be a traumatic ulcer. So if she's brushing her teeth and she slips and hits the gums somewhere, well, that could form an ulcer. It would not form toothbrush abrasion right away. So does that make sense? Because a lot of you, I was able to trick a lot of you. And I did that on purpose because I want you guys to be thinking. So, but does that make sense though, you guys? Why traumatic ulcer is the most correct? If not, please let me know. Where is herpes labialis the most common? So this is the lips. So herpes labialis starts at the lips. It's the most common. Technically, it could be anywhere, but we're talking specifically the lips, right? So that's why the lips is the most correct. 67. What does herpes labialis look like in its most contagious stage? They love to ask you guys about this because this is something you need to be watching for, of course, in the dental office. You would not just simply see a patient and go, well, yeah, it looks bad, but I'm sure it's not contagious. So you need to know what contagious actually looks like. So contagious would be those papules that look pretty nasty, right? Fluid-filled papules. This you have to know. It's the best answer. A burning sensation is not in the contagious stage. Like that's just kind of where one might be forming. But if it looks bad, it's contagious, okay? So please send the patient home. I have done this many, many times. Even when the dentist says, no, you do not have to send them home, I say, too bad, I'm not touching them. I mean, I don't say it like that, but you get the idea, right? I say, well, you can clean their teeth. I'm not cleaning their teeth. It's highly contagious. No, thank you. Again, I don't say it like that either, but you get the idea. With herpes zoster, clusters of vesicles develop along the pathway of a what nerve? I was surprised that a lot of you guys got this wrong. So it's the sensory nerve. That's the only like nerve here that would make sense. So the sensory nerve, because remember with shingles, it will develop on one side. So left side isn't wrong, but that has nothing to do with the nerve, right? So always read the question. I tried to trick you guys. At what age is herp angina most common? So you guys have to know this. This happens in younger children, so 6 months to 5 years. And this is because between these ages, they're putting everything in their mouth, so it's quite common. My sister has been working at a daycare center for a couple years now, and she says that she sees this all the time. So it does happen. Now, 6 months to 2 years isn't wrong, but in the textbook, it says 6 months to 5 years. So that's why C is the best answer. And that is, at what age is herp angina the most common? Next one. With erythema multiforme, you will typically see this on the extremities. So think like arms, hands, legs, you know, anything like that. Yes, it could be seen inside the oral cavity, but still, A is the best answer because this is direct from the textbook. So you need to know this, because if you just simply said the oral cavity and on the skin, well, you're missing the arms, legs, everything, right? So yes, on the skin isn't wrong, but you always need to be as specific as possible. So that's why this is the most correct. Where is nicotine stomatitis most commonly seen? From smokers, you guys. So hard and soft palates. Hard palate is not wrong. Soft palate is not wrong. But C is the best answer because it's hard and soft. And D is not correct because it's not the interior of the hard palate. It is the posterior. So keep that in mind. I tried to trick you guys. Where is a residual cyst located? So where is that? It is the apical area where a tooth has previously been extracted. So it's not that there's no tooth, that there hasn't been a tooth there ever, but there was a tooth, but now isn't. That's the best answer. So where there was a tooth, but now there is not. A residual cyst. Memorize that. They love to ask that on the board exam. Radicular cysts are associated with a non-vital tooth. You guys have to know that. You have to know the differences between a non-vital and a vital tooth. So again, the radicular cyst is in a non-vital tooth. Last but not least, where would you find a globule maxillary cyst? So this would be between the maxillary lateral incisor and canine. The only answer and the best answer. So how did you guys do with those ones? Let me know. I will be adding some more questions to the app every single week because it is almost May and the board exam is fast approaching for a lot of you guys. So, and I tell my students all the time, always go through mock exam questions because this will help you know what you know and what you don't know, because there's nothing worse than taking the exam and then saying to yourself, okay, I kind of wish I had a textbook quickly to look up a lot of these answers. But you can do that now as you're prepping, right? So now is the time. As you guys can see, there's tons of questions inside the app, tons, and there will always be some more being added as well. As you guys can see too, the oral pathology seems to be the most common one so far. There's tons of questions in all of them. As I said, I will be adding some more every single week. So keep on watching. I do suggest to update the app every Sunday. You guys do have the app link inside the actual course. So have a look at that. If you need the link again, you just have to look inside the course. But if there's any issues with the link or anything, just let me know and then I will send that to you also. So thank you guys so much for listening. Good luck, happy studying, and I will talk to you guys very, very soon.